Today we'll learn about different types of tests available for COVID-19, their accuracies, and which test should you take. Hello, I am Dr. Jimmy Douglas. Let's get straight to the topic. Molecular and antigen tests are for diagnosis of COVID-19, while antibody tests are for sero surveillance. Molecular tests are also known as viral test, nucleic acid amplification test. These tests are meant to detect whether you are currently infected. While RT-PCR is the gold standard, let's see what RT-PCR is. RT-PCR, it detects the genetic material of SARS COV-2, the single-stranded RNA. You'll get the report either as positive or negative. CDC recommends different acceptable ways on how the sample can be collected. Naso-pharyngeal swab is the preferred sample, and it is taken from the nasopharynx, accessed from the nose. The Oro-Pharyngeal sample can be taken after you protrude the tongue, like this. Other method of sample collection is at mid-turbinates, as shown. While there might be a little discomfort while the sample is being taken, but there is no pain. After the sample is taken, it is placed in the viral transport medium, packed and transported to the lab to be processed. While there is no test which is 100% accurate, more so when the kits are produced at a very short notice and introduced. While the results are not readily available, taking up to a few days depending on many factors, but when RT-PCR test is reported as positive, we consider it as a confirmed case. When we want the results fast within clinically relevant time frame, we go in for antigen tests, which are reported in 30 minutes. While RT-PCR detects the genetic material, antigen test detects the specific proteins of SARS CoV-2. While the Naso-pharyngeal and the Oro-Pharyngeal swabs are taken, and the test is reported either as positive or negative. The question is, can we rely on these reports? To deal with this, ICMR, Indian Council of Medical Research, has a testing strategy in place. If the patient is negative but is symptomatic, then it has to be confirmed with RT-PCR. They have found out that antigen tests are giving very low false positive and are very specific. That's why when we get a report as positive, it is taken as true positive. As of 14th August, 3 rapid antigen test kits are approved and validated by ICMR, as shown in their website. Antibody testing is done to check whether you were infected in the past. To check these antibodies in the blood, the sample taken are either through finger prick or by drawing the blood. Many countries are doing it at the population level or in specific groups like close contacts of confirmed cases or within households. The antibodies, if present, doesn't confer immunity from reinfection, and this is still being studied. That's it for today. I hope I have simplified it enough for you to understand. Thanks for watching. See you soon.